Hi guys, welcome to yet another episode of the Table Talk. It's been a minute, just flare up after flare up, and then life was happening. But yes, we are back again with yet another episode where we are going to be talking about cervical cancer. Cervical cancer. And before we start, just want to share the news that we got nominated for the Zim Achievers Awards in two categories. That is category 1, Future Leaders of the Year, and then the Gynae Warriors Network. But anyway, without wasting so much time, let's quickly go into it. What is cervical cancer? So cervical cancer is referred to as a mass or a malignant tumor that is found in the lower uterus or in the lower womb or in the lowermost parts of the uterus. I will try and simplify some of the terms so that we can understand each other. So, like I said, it's a malignant tumor. Remember, we've got two types of tumors, which is malignant and benign. Malignant and benign tumor. And benign tumor is the one that is usually painful and has a bit of discomfort. So I don't know, because when we're still in uni studying clinical and public health treatments and technologies, they said that between the two, the dangerous one is malignant. So when it comes to cervical cancer, we are always encouraging every other woman to conduct a pap smear. Some suggest 6 months, some suggest 12 months. The reason being, it is very difficult to know that you have got cervical cancer unless you have done a pap smear, because it doesn't have a lot of signs and symptoms that are visible that you can be on the lookout, except for excessive bleeding. But otherwise, you often find that you have cervical cancer at a later stage when it has already spread. So I encourage every other woman to get the pap smear. That is how you can diagnose, or that is how you can see that you have got cervical cancer, and then with further tests they can check. And also, a pap smear is very essential because it helps you to be on the lookout of what might be happening inside your VJJ or inside your uterus. Anyway, so the signs and symptoms of cervical cancer are a bit tricky, or are not that visible. In which cases, if you have other premenstrual health disorders such as our endometriosis, our PCOS, our fibroids, our cysts, adenomyosis, because due to sometimes you can get heavy bleeding and prolonged bleeding. Sometimes it's usually passed on as it's one of those months where your condition is a bit worse. So it is very difficult to know. Okay, so who is at risk of getting cervical cancer? Because some of the ladies that I have talked to, they're like, no, in my family there's no cervical cancer, so it cannot start with me. So today we are going to practically talk about who are at a high risk of having cervical cancer. That is, first, the people who usually smoke. Smokers have a greater or larger risk of getting cervical cancer, and also to the people that have a weak immune system, who have a weakened immune system, such as people who are exposed to the HIV and AIDS virus, and also people who have been pre-exposed to sexually transmitted diseases, especially chlamydia. They are at a high risk of developing of developing cervical cancer. Hence, we are always saying if you're someone who wants to change their partners quite often, you are encouraged that you keep yourself safe and you use the prevention methods such as the condoms, and also having multiple partners or having a partner who's sexually active with other multiple partners can put you at a higher risk of having cervical cancer. And then we have got long-term use of oral contraceptives, and I feel like when it comes to oral contraceptives, and also we have got diet. Diet is one of the top factors that can affect a woman and thereby result in them having cervical cancer. Especially now that we have got this news and we are now exposed to a lot of information whereby people are mixing things in our drinks, in our food, in the meat that we consume. So you never know what they are mixing and what how much role it's gonna play in regards to your health. Is it good for your health? Is it bad for your health? So you need to be on the lookout regarding the diet that we eat, and also especially if you're someone who has got underlying conditions, like some of us, like PCOS, endometriosis, fibroids, adenomyosis, you need to be on the lookout of what you eat so that it doesn't encourage the excessive growth of cancer cells. Family history. Some are prone to have cervical cancer because of genetics and family history. So in your family, if there has been a history of cervical cancer, or if there have been a history of menstrual health disorders, you are prone and you are at a high risk of getting cervical cancer. And then the uncomfortable one is obesity. So people who are excessively obese are at a high risk of getting cervical cancer. I just want to touch base on the signs and symptoms of cervical cancer, what one needs to be on the lookout for. So we established already that vaginal bleeding is one of the common denominator when it comes to issues of the cervical cancer of the cervix. So bleeding after menopause, there are some women who quickly enter menopause and some are late. But menopause, just to give a brief background, is the period where a woman stops her menses because they are no longer of childbearing age. So if you start bleeding and you are past menopause, or you're during menopause, or you're pre-menopause, then you need to be on the lookout for what could be wrong. Bleeding between periods, like your periods is supposed to be on the 15th up until the 20th, and in between that you are constantly having periods where you have to bleed. We also have vaginal discharge that is all watery and that is smelly and that has got blood in it. It is also one of the signs and symptoms that you need to look out when it comes to cervical cancer. We also have the issue of heavy and prolonged periods. Hence, I said that if you're someone who has got other menstrual health disorders, it's difficult to know if you've got cancer, because it sometimes happens that you have prolonged periods. And then we are going to talk about ways on how best we can avoid, or how you can try minimize your risk, or a person's risk of getting cervical cancer. So we are going to start by getting the HPV vaccine if you are eligible. And in case where you're still exploring and you're still trying to figure out if this one is your soulmate, it's highly advisable to use protection, to use condoms. You need to be careful in regards to your diet, what to eat and what not to eat. stop using tobacco products. I'm not so sure if there is a relationship or a correlation or relationship between the new e-cigarettes and the use of cervical cancer. So that is a study that I think people can go around and read, or they can study more. But definitely tobacco, definitely need to keep fit to avoid obesity, and definitely you need to get your pap smear every 6 months or every 12 months. So some do suggest that there is a link between lumps that are found in the breast and cervical cancer. So if you are one of those patients, you can always, they always say, my gynae once told me that it is always advisable that every day when you are showering, or once a week or once in 2 weeks when you are showering, you just press your breast and see. It also helps with breast cancer. You just press your breast, try to feel them around and see if there's got a foreign lump that you don't know about that is just lying idle amongst your boobs. So there is a relationship or a combination or a link between breast cancer and cervical cancer. So yeah, that is the bit of information that I had in regards to cervical cancer. And yes, if there is early detection of cervical cancer, there is probability that you can beat cancer. You can be one of the survivors, especially if you are on the early stages or if you are in the early stages. Before we conclude, obviously we will do a more in-depth introduction to cervical cancer, but before we conclude or before we go, we just want to highlight that we are entering the 16 days of activism, which starts from the 25th of November and up to the 10th, if I'm not mistaken, of December. So please let us be kind to one another. Let us stop any form of abuse. Let us stop any gender-based violence. It can be violence against fellow women. It can be violence against men as well, because we are living in a world where our men are going through a lot. So in regards to that, we just want to say, may we be the kind person, may we be the change that we want to see, may we be the person that brings solitude and that brings happiness to the next person. And alright, just before we close off, someone asking what is Gynae Warriors Network, because we did mention that we were nominated in 2 categories. So Gynae Warriors Network is a collective of African countries who are coming together to advocate change, to change policies, to break certain taboos and break certain myths regarding menstrual health. It's a organization that helps women get through the diagnosis of different menstrual health disorders. And we are also an organization that thrives to bring sustainability, introduce sustainable solutions in regards to women's health, coping mechanisms, what can be put in place, because it's not everyone that can access healthcare facilities, especially when it comes to the private sector, and the process is just way too expensive. So that is what we do at Gynae Warriors Network, and we'll also bring patients and doctors and therapists together as one, and we will help you find a gynae closest to you. We also do community engagement or community awareness programs where we educate kids, women. The thing about menstrual health disorders is people think that it affects women only know. It affects everyone. It can, for you, it can be your daughter, your sister, your aunt, your niece. It can be your student. It can be your neighbor. It can be your worker, your employee. So until next time, thank you so much for watching. Bye.